what we see too is that these changes to the gut microbiome, they worsen with stage of disease. And so we see it very early in the disease process. So we saw it in the cats with stage 2 chronic kidney disease. And as the disease progressed, the changes got worse and worse.
Hey everybody, welcome back to another episode of VetFolio Voice. This one sponsored by DECRA and featuring Dr. Stacy Summers. In this episode, we're diving into a topic that we've been spending a fair bit of time on recently, and I'm so glad we have because it's super interesting, and that's microbiome medicine, and in this case in particular, the influence of the GI tract and the microbiome on chronic kidney disease in our feline patients. If you've listened to the podcast before, you may know that I love talking about kidney disease. I think it's fascinating, and now that we're talking about the GI tract as a potential target for therapy, it's just opened this whole new world of treatment options in these patients. In this kind of nitty-gritty episode, Dr. Summers did an amazing job of really breaking things down, sometimes almost to a molecular level, and explaining why we see certain changes in the GI tract in cats with chronic kidney disease, and the influence of those changes on kidney health. And then, of course, on the flip side, how we can target the GI tract to help manage the progression of kidney disease. This episode is a pretty long one, and like I said, we really broke it down on a very detailed level, so I won't say too much more. Let me go ahead and introduce Dr. Summers, and let's talk kidney disease. Dr. Stacy Summers is board certified in small animal internal medicine and has a special interest in feline medicine. Stacy grew up in Southeast Idaho and graduated with her DVM from Washington State University. After veterinary school, she completed a rotating internship at Wheat Ridge Veterinary Specialists in Colorado, followed by a feline infectious disease research fellowship at Colorado State University with the Center of Companion Animal Studies. She completed a residency in 2018 and a PhD in 2020 at Colorado State University. Her PhD work was on novel etiologies and the role of the gut microbiome in cats with chronic kidney disease. Stacy has a special interest in feline medicine, particularly the diagnosis and management of chronic kidney disease. Her current research focuses on chronic kidney disease and the gut microbiome of cats, as well as ways to reduce stress and fear behavior in cats during hospital visits. All right, let's go ahead and jump into our talk.
Join more than 100,000 learners just like you. VetFolio is one of the largest providers of continuing education for the animal health community, offering more than 500 race-approved CE courses. Earn veterinary CE anytime, anywhere with VetFolio. Subscribe today at vetfolio.com.
Well, welcome back, everyone. For this episode, I am joined by Dr. Stacy Summers, and we're going to talk about dysbiosis in cats with kidney disease. And I'm super excited about that fact because it is such a cool topic, thinking about the GI tract in terms of kidney disease. So, Dr. Summers, thank you so much for joining me.
Happy to be here.
So happy to have you. I'm really, really looking forward to picking your brain on this topic. So, I guess we now know that there are changes to the gut microbiome that are kind of characteristic in cats with chronic kidney disease. So can you talk a little bit more about that? Like, how did we, like I had anything to do with it, how did you discover that there was this dysbiosis in cats with kidney disease, and what do we know about it?
Well, we know that in people, it's very well characterized. So it's over a decade of research into the gut microbiome in people with chronic kidney disease and in people on hemodialysis. And so it myself and a colleague, Dr. Jessica Quimby, it piqued our interest to see, well, what happens in cats with chronic kidney disease? As we know, it's very common in our feline population. And so we did a cross-sectional study where we collected fecal samples from cats with chronic kidney disease, primarily stages 2 through 4, IRIS stages 2 through 4. And we characterized their microbiome. And what we found is that changes were actually similar to what they find in people with chronic kidney disease. And so one thing that we find is that there are just fewer bacteria in the gut in cats with chronic kidney disease. This is often called a lower bacterial richness. We also find that there's less bacterial diversity and that the bacterial population is dominated by just very select bacterial species. There's not a nice diversity of bacterial species in the gut. And so what we see too is that these changes to the gut microbiome, they worsen with stage of disease. And so we see it very early in the disease process. So we saw it in the cats with stage 2 chronic kidney disease. And as the disease progressed, the changes got worse and worse. So it also affects cats with late stage disease as well.
Interesting. Okay, so less bacteria overall, less bacterial richness, and then less diversity in the bacteria that is present, and that's worsening. It starts as soon as we start to see kidney compromise, essentially, and then it will continue to worsen. Do we know why that happens?
The main thing is we believe that there's a change in the gut pH due to reduced excretion of urea by the kidneys. And what happens is the urea accumulates in systemic circulation, and the gut becomes a site of basically to try to secrete more urea. And so more urea makes it into the gut lumen. The bacteria in the gut lumen then transform it into ammonia, and that ultimately will increase the pH. So it just changes. This increase in urea influx into the gut, transformation into ammonia, change of pH just changes the environment, and that by itself can change the type of bacteria that wish to live in that type of environment. But there's also other likely contributing factors too. One is frequent antibiotic use in cats with chronic kidney disease. Especially these cats are often older, and so they've likely been exposed to antibiotics at some time point in their life. And what we find is that when cats are exposed to antibiotics, not only does it drastically change the microbiome, but it sometimes can be a permanent change, or at least a very long-term change to the microbiome. And so historical antibiotic use probably contributes. And then there's also this, better documented in people, but we believe this also happens in cats, is protein malassimilation in the small intestine. Essentially, the protein they take in through their diet, it's becoming less digested and absorbed into systemic circulation. So more protein is making it into the colon. And in the colon, these bacteria then use this protein for fermentation. And so just simple ecology, if there's more protein, a more protein substrate, those bacteria that use protein for fermentation are going to flourish. And so there's kind of a change in the type of bacteria present, more proteolytic bacteria, essentially bacteria that use protein for fermentation, rather than saccharolytic bacteria, which use fiber for fermentation. And the big problem with this issue is that this fermentation of protein leads to the production of these gut-derived uremic toxins. And the major gut-derived uremic toxins are called indoxyl sulfate and p-cressyl sulfate. And these toxins that are derived from protein fermentation by bacteria in the colon are just plain evil. They promote renal inflammation and fibrosis. They reduce erythropoietin and red blood cell lifespan, therefore worsening anemia as we see in these cats with CKD. They stimulate the renin-angiotensin-aldosterone system, thereby worsening the hypertension, and they can cause cardiovascular disease. So this dysbiosis changes the bacterial population. There's more protein for these bacteria to use to ferment, ultimately leading to these uremic toxins that are produced as a sequela of protein fermentation. And so this dysbiosis and these accumulation of these more gut-derived uremic toxins, I think is a therapeutic target that should be a focus in practice.
The more we learn about this, the more I learn about this listening to brilliant minds like yourself. It's just, I mean, it's really fascinating, and it just kind of makes me go, wow, just all that we've learned, even in just the last few years, about kidney disease and the progression of kidney disease, the things that we can consider in like therapeutic endpoints. It seems like there's just so much here.
There is. Yeah, there is. There's a lot here, and there's a lot we don't know. I mean, we're very early in veterinary medicine kind of exploring this avenue, but in people, it's huge. In people, it's really important because these gut-derived uremic toxins are often protein bound, and so they can't be removed by hemodialysis, which is a common treatment modality in people with end-stage chronic kidney disease. And so in people, there's a lot of look into how can we then, if we can't remove it by hemodialysis, what are other strategies? And so while we don't use hemodialysis for chronic kidney disease often in veterinary medicine, I still think the same principles apply.
Sure. And that's perfect, 'cause that's kind of where my brain was going next of what can we do to reduce the accumulation of, these proteolytic bacteria and uremic toxins.
I think there's 4 strategies to consider. 1 is decreasing the amount of protein dietary intake. 2 is increasing the intake of soluble fiber. 3 is treating constipation. And 4, using oral adsorbents to actually absorb uremic toxins that are produced in the gut. And so if we look at these 4 strategies more specifically, let's start with decreasing protein intake. And I do realize this is a very controversial, especially when it comes to cats, being that they are obligate carnivores, but it's also a big mainstay of treatment in cats with chronic kidney disease to at least care about the amount of protein that they're eating. And so there was a study in cats with chronic kidney disease where they were fed 3 different diets of variable protein concentrations, and all 3 diets had the same amount of phosphorus. So they took the variable of phosphorus out of the equation. A lot of the historical studies in showing the efficacy of renal diets in cats with CKD, they just looked at renal diets that were both phosphorus and protein restricted. And so it was really hard to kind of glean where the benefit was. Was it in the phosphorus restriction or protein restriction? The cool thing about this study is that they, again, 3 diets of variable protein sources, and phosphorus concentration was the same of all 3. So it really was looking at the benefit of protein restriction in cats with chronic kidney disease. And what they found was that cats that fed controlled amounts of protein had less protein-derived uremic toxins. So essentially, the less protein you fed, the less uremic toxins that were produced. And of course, the diet with high amount of protein had the highest amounts of uremic toxins. So clearly, dietary intake of protein influences the amount of these uremic toxins that are produced. And again, very controversial. And unfortunately, there's not just a blanket statement of we can't just say, oh, all cats with chronic kidney disease should be on a low protein diet. I think it's very variable between stages. It's variable between what they're currently eating, the current amount of protein that they're eating, and kind of what sequelae of the disease they're suffering from. For example, do they have uremia? Do they have proteinuria? So I would say it's not necessary that you need to feed a low protein diet, but we do have to make sure they're not on a high protein diet. And I bring this up because over-the-counter diets are highly variable in protein, highly variable. There are some diets out there that are really high in protein. We would never want to feed a cat with chronic kidney disease. And there's also over-the-counter diets that have a protein level that are actually quite similar to some of our renal prescription diets. And so we just have to care how much protein they're getting. They may not need a low protein diet, but we certainly don't want them on a high protein diet. And so when I think of like protein intake targets for me, I kind of strive in cats with chronic kidney disease, just no matter the stage, is to at least limit their protein intake to about 7 to 8 grams per 100 kcals, especially in cats with early chronic kidney disease. As they progress, they go into stage 3 or 4. These are cats that suffer from uremia. They have more uremic toxins. And so those cats may actually need what we call a low protein diet, so a renal diet that's actually low in protein. And when I say low in protein, what I define as low protein is a protein concentration below that AFCO minimum for adult maintenance, which is about 6.5 grams per 100 kcals. And there are a few kidney diets, particularly the ones formulated for more advanced kidney disease, so stage 3 and 4, that are just below that AFCO minimum. And so I think it kind of depends on the stage about how much protein restriction. Cats with later stage may need more. Cats with earlier stage disease may need less. But the bottom line is we do need to care how much protein they're intaking, because we certainly don't want them on a high protein diet.
I love that approach to really thinking about the amount of protein that's in this diet. I love how you put that. Like, we just have to care. We just have to pay attention to it because, you mentioned controversial and, if anything, just very nuanced. Like, it's very individual for that particular cat, what we need to do diet-wise. And so I think that makes a lot of sense to say, okay, well, maybe we don't, in an early stage kidney disease, maybe we don't need to jump straight to, protein restriction or low protein diet or anything like that. But let's at least examine what they're eating right now and see if we can make sure we're just paying attention to that. We're not on a high protein diet. Maybe we can reduce it a little bit and still, keep it healthy for that cat. And to one of your points, when you say a low protein diet and less than that AFCO minimum, in those cases, those are always going to be prescription diets. Is that correct?
Generally, they're always going to be prescription diets. Yep.
Sure.
Yeah. And that's why they're prescription diets, is because they're, prescription diets, there's often a nutrient that's below one of the AFCO minimums of some nutrient. And so for renal diets, that can be protein and that can be phosphorus. And so these renal diets should be prescribed to cats with chronic kidney disease. They're not intended for adult maintenance because some are below those AFCO minimums.
Got it. That makes sense. And that really, I think, gives us kind of a broad brush to look at these cats with kidney disease and examine their diet protein-wise without, in a way, it's almost easier not to say, with this stage of kidney disease, they need to be on a low protein diet because it is so variable for our individual patients. So I love that way of looking at it. Yeah,
and there's some diets that are really high in protein over the counter. And just to give you some perspective, again, the AFCO minimum of protein is 6.5 grams per 100 kcals. That's the minimum amount of protein for healthy adult maintenance. But there are some over-the-counter diets that are 17 grams per 100 kcals. And so it's just that's tremendous amount of protein, which for a cat with chronic kidney disease could be quite dangerous, would definitely lead to accumulation of these uremic toxins. And so if you had a cat on that high a protein that has stage 2 chronic kidney disease, there's potential that you could look just for, maybe even within the same brand, look for another over-the-counter diet that has less protein, which your options would probably be quite a bit, So it's not necessarily you have to go to a renal diet right away, but you should care about the amount of protein the cat's currently eating. And if it's quite high, which I think of high as greater than 10 grams per 100 kcals, then let's just try to restrict it a little bit at least, and then reassess to see, do I need more protein restriction? How's the cat responding? What's their body weight, their body condition score? And so it's just trying to reduce the amount, and sometimes, especially in cats with early stage, you can use some over-the-counter diets.
17 grams per 100 kcals. I would imagine we're going to create some problems with those diets. And, certainly I think it gives us a good jumping off point to communicate with owners about the importance of diet because, for example, if the amount of protein isn't findable, isn't available for whatever diet this cat is eating, then, maybe that gives us reason to say, okay, well, let's at least switch to a diet where we do know the amount of protein that your cat is eating, and then we can kind of aim for those target ranges.
And I think also when it comes to protein and these gut-derived uremic toxins, it's not always just about the concentration of protein in the diet. It's also important to feed a high quality protein, so one that's digestible and complete. Because if we're feeding really low quality proteins, that by itself is going to reduce digestibility of the protein, and then more proteins are going to get to the colon where these bacteria are going to transform them into these uremic toxins. And so it's not only concentration of protein, but we also need to focus on making sure we're feeding these cats with chronic kidney disease a high quality protein source too.
I think that really speaks to these feeding trials and things along those lines, because if I'm remembering correctly, the amount of protein we should be able to find, hopefully in these diets, or switch to a diet where we can find the amount of protein. But as far as the quality goes, we're really relying on our food companies to have high quality protein sources that are digestible and bioavailable for these patients.
Yeah, absolutely. You cannot tell the quality of a protein by looking at bag food labels. It is 100% dependent on the food company doing digestibility studies, doing their food trials to make sure that the protein they're putting in their diet is highly digestible and complete. And so it's really depending, it's 100% dependent on the food company to help us, to make us feel confident that they're using good quality protein sources.
And I think that's just all such great information to have on just thinking about protein intake in these patients, because there are varying opinions and really like varying needs for patients. So those are like, I think those are just such usable guidelines to say, okay, like let's look at it from this point of view in our patients in terms of protein, and really gives us, especially out in general practice, that flexibility to make sure we're making good recommendations for our patients and take into account all the individual variations that we will inevitably see. The second strategy that you mentioned was fiber. And that, I mean, it seems like it would make sense that we're talking about the proteolytic bacteria in the colon, and so increasing the fiber would help with that. But maybe I'm thinking about that wrong and not remembering soluble versus insoluble fiber.
Yeah, fiber, I think, is a hard concept to grasp sometimes.
Sure.
And so there's one category of fibers, insoluble or soluble. And insoluble just means that the fiber cannot be dissolved in water. Soluble means it can be dissolved in water. But a term often used interchangeably with soluble fiber is fermentable fiber, because often soluble fibers are fermentable, meaning our gut bacteria can use the soluble fiber as a substrate and ferment it and produce metabolites, essentially. And so another strategy to try to reduce these gut-derived uremic toxins from being produced is to actually increase soluble fermentable fiber intake. And so essentially, if you increase the amount of fiber, we're now kind of switching the microbiome to a population that then uses fiber for fermentation. And actually, the fermentation of fiber produces beneficial metabolites. Unlike protein fermentation by microbes cause these gut uremic toxins to be reproduced, fiber fermentation produces beneficial metabolites like short-chain fatty acids that have anti-inflammatory properties, really are important for gut health and maintenance of the gut barrier. And so if we increase fiber, we're trying to basically switch the microbiome from a population that uses protein for fermentation to those that uses fiber, and potentially could lead to some beneficial metabolites being produced. And that's some of the thought process behind Hill's KD was just reformulated. And if you look at the bag, it has a symbol for active biome. And that's some of the science behind it, is actually adding some fermentable fiber to these diets for patients with chronic kidney disease to try to promote a more healthy microbiome.
We've certainly considered that concept of fiber, just in gut health overall, and like you said, short chain fatty acids within the colon, but we've tended to focus, I think, on protein more in kidney disease. And I think it sounds like what you're saying here is it really comes down to a balance.
I think it's absolutely a balance. I think protein's important for these diets for cats with chronic kidney disease, but I think we have to think about fiber and its beneficial effects on the microbiome and how that ultimately can improve gut health, but then also reduce these uremic toxin production.
And this is where I think this conversation just gets so cool, of how we can make these dietary changes that ultimately affect the microbiome and help these cats with kidney disease and all of the pathways behind them. It's fascinating. And the other thing that I know about cats with chronic kidney disease, and I think it just makes sense, is they're not passing stool as frequently. And again, I think it just makes sense. Sometimes their appetites take a little bit of a hit. They're probably not as well hydrated as they may have been in the past. And so it just kind of naturally follows in my head that they wouldn't pass stool as often as cats without kidney disease. I don't know if that's the right way of thinking, but it's just how my brain sees it.
It was definitely, I think when it comes to constipation, the main factor is the hydration status of the patient. Any cause of dehydration, especially chronic dehydration, can cause constipation, because that's one of the major functions of the colon is to absorb water from feces. And so if you're dehydrated, your colon's going to be working hard to absorb as much water as it can from fecal matter, thereby resulting in kind of firm, hard stool and constipation. And that's actually the third method that can be used to try to reduce these gut-derived uremic toxins is treatment of constipation. And it's purely just, you're just limiting the time that these bacteria have to take this protein, ferment it, and produce uremic toxins. You're just increasing GI transit time to limit the time available for protein fermentation. And although this is primarily in people, it's been documented, but in people, those patients with kidney disease that have constipation have higher uremic toxin levels than those without constipation. And so treatment of constipation could essentially help reduce those accumulation of uremic toxins.
Does the increased fiber in the diet affect constipation as well?
It can help with constipation, fiber. It kind of depends on why the animal is constipated. Fiber can certainly, some fiber sources can bulk the stool, and kind of more bulky stool can promote colonic motility. It also promotes a more healthy microbiome, and the microbiome can be directly linked to poor colonic motility. So essentially improvement of the microbiome could improve colonic motility. There are also some fiber sources are what we call a viscous property. Essentially, when the fiber is mixed with water, it turns into a gel. And the classic one in veterinary medicine is called psyllium husk fiber. When psyllium husk is mixed with water, it forms this gel. And especially in the colon, this gel kind of coats the feces and helps with passage of stool. And so some fibers certainly can help just by basically lubricating stool and help with passage of feces.
Absolutely. Absolutely. So if we reduce the amount of protein to a reasonable level based on our patient, we're not ending up with as much protein in the colon, and then we're increasing fiber. So then we're altering that microbiome to where we don't have as many of these proteolytic bacteria, and we are getting more beneficial things like short-chain fatty acids and less gut-derived uremic toxins. And then we also at the same time decrease that GI transit time where they're passing stool more frequently and treat that constipation. Then it sounds like there would be less opportunity for the gut-derived uremic toxins to form. And so overall, that would create a healthier environment for the kidneys.
Exactly. Yeah, it's all three of those things can be really beneficial to essentially change the microbiome, change the amount of protein substrate that gets to the colon, and just reducing time of these microbes to transform this protein into uremic toxins. So treating constipation. And then the fourth method I mentioned was actually using an oral adsorbent. And so of these four methods, using an oral adsorbent is the only method that actually directly targets and reduces uremic toxins directly. Like a lot of the other three things we talked about was changing the microbiome, reducing the substrate for the microbes to produce uremic toxins. But oral adsorbents actually absorb uremic toxin precursors in the gut so that they can't be systemically absorbed and transformed into uremic toxins. And so we do have a product for cats called Porous One. What Porous One is they're carbon-based spheres, really tiny spheres. They're actually added to the food once to twice a day. And these carbon spheres trap small molecules like uremic toxin precursors. And then you void these precursors in the feces instead of, again, being systemically absorbed. And they're tiny little black spheres, tasteless. When I first got my hands on Porous One and opened up the little packets, they're finer than a grain of salt. And so it's nice because the cats don't even really notice it's mixed in their food. It's completely tasteless. It's tiny, might add a little bit of a gritty, but seemingly cats seem to accept it quite well. And again, it's only strategy that directly targets those uremic toxins. And myself and colleagues at Ohio State and University of Georgia, we did do a study using Porous One in cats with stage 2 and 3 chronic kidney disease. And it was a cohort study where we had this cohort of cats with chronic kidney disease, and we provided them Porous One actually in a churu. We mixed it with a churu and gave it to them as in a churu liquid cat treat. And we did that once a day for 8 weeks. And then we did it twice a day for 8 weeks. And then measured the amount of serum uremic, these gut-derived uremic toxins in the blood before and after, essentially. And what we found was that both giving Porous 1 once a day and twice a day reduced the amount of uremic toxins in the blood of these cats. So it seemingly was quite effective and pretty cool because it's something that you can add to whatever diet the cat is eating, right? Like diet management, of course, is an important part of reducing uremic toxins. But now we have a product that whatever the cat chooses to eat, whatever the owner chooses to feed their cat, we have something that can just be added to the food and still help to reduce these uremic toxins from accumulating.
That is so cool. And I love that it's like it's a supplement, and so not something where you're having to maintain prescriptions and things along those lines. And to hear that the cats are accepting it that readily. I mean, honestly, what did we do before churu?
So true.
If they'll eat nothing else, hopefully they'll at least eat a churu.
Exactly. Yep. So yeah, they just mix it with the churro once a day. You can, and it doesn't have to be churro. You can mix it with canned food. You can mix it with kibble. You can mix it with kibble too. But I think mixing it with some sort of canned food or the churro is better because it kind of gloms in, in the food or churro. If you put it in the dry food, it may sift to the bottom of the bowl. And so, mixing it with something like canned food or churro may increase the likelihood that cats can actually take it in. But you can even give it to cats that are free fed, if they eat their dry kibble, mix it with their dry kibble, and it will still be effective.
Absolutely. Yeah, you're saying it's finer than a grain of salt. I can imagine that it would probably stick reasonably well even with dry kibble.
Yeah.
Because we know those kidney cats and how they are. And some of them just will refuse anything except for dry kibble, even despite our best efforts.
I know. Very true.
And, kind of along those lines of these cats who, they kind of make the rules when it comes to treatment. When we're talking about dietary recommendations more specifically, I mean, like we talked about before, those strategies make a lot of sense in order to affect the microbiome and benefit the kidneys. Can you give us some specific dietary recommendations for cats with CKD? Like, for example, I'm picturing an owner who comes in and we say, okay, maybe we should consider like an early renal diet for your cat. And they say, nope, we're not doing that. We're going to feed such and such over-the-counter diet, and I don't feel good feeding anything other than this diet. How do we approach those cases?
Yeah, really good question. I mean, there's a lot of science behind these renal therapeutic diets, and there's several studies that show that it increases and improves their survival and decreases the chances of uremic episodes. And so I do think these renal diets are beneficial, but yes, we definitely in the real world get in these scenarios where for whatever reason the cat won't accept it, or the owner, has their own desires and what brand of food they would like their cat to be on. So understanding the science behind these renal diets, it's understandably why the International Renal Interest Society does recommend renal diets for cats with stage 3 and 4. Because these are cats with more advanced disease, they're having issues with uremia, and so the IRIS does recommend a kidney diet for that stage. Cats with stage 1 and 2, it's a bit more controversial, and it's a bit more, there's not a general consensus on what to do. In stage 2, we should consider it, and for stage 1, there's just no general consensus. And so because of that, I think that stage 1 and 2 cats, there's some wiggle room in kind of using potentially over-the-counter diets to help manage their disease. And so particularly, again, for those cats with early stage, so stage 1 and stage 2 CKD, it may be that we just utilize an over-the-counter diet if the owner is unwilling or unable, or the cat's unwilling or unable to accept a renal diet. And so it's focusing on the protein and phosphorus concentration of these over-the-counter diets and finding one that works for that individual patient. Now, there's a lot of other components or characteristics of renal diets that are beneficial. So, for example, they're usually higher in potassium for cats with chronic kidney disease. They're alkalinizing and they help treat the metabolic acidosis. They have a controlled sodium intake, and they're often supplemented with omega-3 fatty acids. But if we just look at just protein and phosphorus and management of uremia and phosphorus overload, I think there's a lot we can do with over-the-counter diets, particularly for stage 1 and stage 2 chronic kidney disease. So some over-the-counter diets, particularly foods that are labeled for senior cats, have a protein and phosphorus concentration that are just above that AFCO minimum for adult maintenance. So not low per se in these nutrients, but just above, which is actually very similar to some of the renal diets that are formulated for stage 1 and stage 2. So that they're called like early care kidney diets or early support kidney diets. And so we actually can find some over-the-counter diets, and I'd start with looking at senior diets that closely match the protein and phosphorus concentration of some of these early care kidney prescription diets. Similar, as I mentioned before, for over-the-counter diets, the dietary protein, but also dietary phosphorus is highly variable in over-the-counter diets. Particularly for phosphorus, AFCO does not publish a maximum amount of phosphorus that can be allowed in the diet, meaning that there's no ceiling. So there's no guideline for what's too much phosphorus for a cat. But we do know there is some science that shows that too much phosphorus, particularly of inorganic phosphorus sources, so sources of phosphorus that are not from meat, essentially, or organ meat, those inorganic phosphorus at high levels can actually cause kidney injury. And so we also, just like protein, we need to care how much phosphorus the cat is eating, because there can be some over-the-counter diets that are super high in phosphorus, and that's the last thing we want to do in our cats with chronic kidney disease. So generally what I have is if I have a stage 1 or stage 2 cat that and the owner declines using one of the early care, early support kidney diets, then the next question I ask, okay, well, what are you currently eating? I then try to investigate to try to determine the amount of phosphorus and protein in the cat's current diet. And that gives me a baseline. Okay, I know they're eating this much protein and this much phosphorus. I'm going to shoot for lower than that using an over-the-counter diet. And so if there's a owner that really loves a certain brand of food, I'm going to look at other flavors of food or types of food within that brand and see if I can shoot for something that's lower in protein, lower in phosphorus. And as general guidelines that I follow in respect to protein and phosphorus, I'm kind of shooting in a cat with chronic kidney disease stage 1 or 2 for a protein content of about 7 to 8 grams per 100 kcals. And usually for phosphorus, somewhere around 1.3 to 2 grams per 100 kcals for phosphorus. That's kind of where I'm shooting, but it all depends on where you're starting at, right? If the cat's already on a super high phosphorus, super high protein diet, well, then you just need to reduce that to some amount. And again, reassess your patient, see how they're responding. And if you need to, reduce the amount of phosphorus again. But there's a lot of wiggle room that we can for over-the-counter diets when it just comes to looking at those two nutrients.
Again, I think it gives us that flexibility, that wiggle room that we need in working with owners just to deal with some of the food preferences that the owners may have and also that the cats may have because, yes, they kind of, like we talked about, make the rules here when it comes to what they're going to eat. So that I'm loving this conversation because I think it's really empowering to say, okay, we can still benefit these cats with CKD from a dietary standpoint and influence the microbiome and really help them, even with owners or cats that give us kind of parameters that we have to work in that are outside of what we might have recommended before.
Yeah, absolutely. And, I think palatability is something we struggle with these renal therapeutic diets, and the food companies are always finding ways to make them more palatable and oftentimes successful at doing that. But at the end of the day, what's most important for a cat with chronic kidney disease is caloric intake. Like, we want to make sure they're eating enough calories. And so we're supporting them with anti-nausea meds, with appetite stimulants, and we need to find a diet that they will eat. And if they will not exclusively eat a kidney diet, then we have to find something else that they will eat. And that something else, we may not want to give the owner free rein to decide, but maybe give them options. And that may be giving them a list of over-the-counter diets that may be more palatable, may have a higher amount of phosphorus or protein in the diet, but it's not a too high of amount. It's something that they'll at least eat, and you're doing something to restrict their amount of protein and phosphorus intake. So caloric intake should be prioritized. And another thing about these renal diets is that even eating a third of a renal diet and then 2/3 of an over-the-counter diet is better than eating no renal diet.
That's good to know, because I had a patient like that who, whenever she started on a fiber diet, ended up with kidney disease, and it was anytime we tried to really take some of her initial fiber diet out of there, she would get constipated, which of course now we know is making her kidneys worse. So she ended up eating half and half, and I always wondered, I'm like, are we negating both of these diets? But I mean, she lived till 21, so I think she did pretty well.
No, I mean, it's kidney diets. You can give them just a portion of it, and it's better than eating nothing. Absolutely. I mean, things like the hypoallergenic diets, like the hydrolyzed protein diets or the novel protein diets, where you're doing food trials to rule out food allergies, those are really diets that shouldn't be mixed with other foods, because it just completely negates your food trial. But that's not true for kidney diets. Even a little kidney diet is better than no kidney diet. And so maybe they'll eat the kibble kidney diet, but they refuse the cans, but they like this over-the-counter senior diet that you looked at and say, hey, I'm okay with this source of protein and phosphorus for this cat. So sometimes we have to just make those accommodations because, again, end of the day, caloric intake should be prioritized.
Absolutely. Absolutely. That makes a lot of sense. I feel so empowered with my dietary recommendations here. So thinking about really analyzing the food that our patient is eating currently and maybe making some adjustments, more subtly to just benefit those kidneys overall. How do we go about that? Where do we find the information to say, okay, this is what this diet has, this is what this diet has, and make those recommendations appropriately?
Great question. And so as I've been talking about, I've always been talking about nutrients in caloric density. So some sort of grams per 100 kcals, or sometimes it's given as grams per 1,000 kcals. And that's the way that we should, when we're comparing nutrients between diets, that's how we should be doing it, is comparing apples to apples and comparing these nutrients in caloric density. So again, it can come sometimes grams per 100 kcals, milligrams per 100 kcals. And that generally can be found in product guides, or sometimes food companies will be very transparent and provide that information on a website. You should at least be able to call these companies, and they should be able to provide you nutrient concentrations in caloric density. And so they are available, and that's the way, again, we compare apples to apples when we're looking at different diets. We cannot use the guaranteed analysis on the food bag. We cannot use that to compare between diets. And that owners tend to do that. They'll go to pet stores and look at the guarantee analysis, but we cannot do it. And there's several reasons why. One reason is often the nutrients are provided as a minimum value. So there's a minimum amount of crude protein in this diet. Well, minimum just says what the minimum is. It doesn't actually tell you what the actual amount of protein in the diet is. And so it's just because they provide these minimum values, it's not very helpful. The second thing is you may see that nutrients are provided as a percentage. So you'll find percent of protein by dry matter basis. That can be a way you can compare between diets, particularly of the same format. So you compare dry foods to dry foods, wet foods to wet foods. But the issue with using these percentages is it doesn't take into account caloric density, right? So two diets can have the same percent of protein, but the total intake of protein will vary if the caloric density of the foods are different, right? A lower calorie density food, you're going to eat more of. And so you'll take in more of those nutrients. And so that's why when you're comparing nutrients, caloric density is going to be the way to go. And again, product guides, looking on the websites of these food companies, or at least calling the food companies. And I will say, if the food company, the more transparent a food company is about their nutrient content, the more comfortable I am feeding that diet. And you should be very wary if you call a food company and ask for this information and they cannot provide it to you. Then that should be a big red flag that,
absolutely.
Okay, that's, I don't want to know the minimum. I want to know the amount of protein in your diet. So if they can't provide that, that should be a red flag.
Yeah, that is something I certainly talk to owners about when I'm making dietary recommendations, especially when it comes to brands, because that's such a big conversation. Is when I say and then this brand and I say, and I can pick up the phone and I can ask a question and they can answer it. They have the
100%.
information, and it's just it's easy to pick up the phone and get a hold of somebody to ask about the information. So
yeah,
100%. This talk for me has been really empowering in terms of being able to make dietary recommendations in these patients and feel like I'm helping them, even if, it's not maybe some of the recommendations I was originally taught in vet school, that there's still a lot that we can do to help these patients. And there's multiple strategies that we can use to influence the gut and really, benefit CKD. It doesn't all come down to like protein restriction or none. So thank you so much, Dr. Summers, for all of the amazing information. It's been so great talking to you.
You're welcome. Always happy to talk about the microbiome. So it's been a pleasure.
Dr. Summers, thank you so much. This topic is so interesting. I think there is just a lot more to say on it in general. So I appreciate you taking the time and all of the information that you brought to this talk. A big thank you to Dechra for making this episode possible. And of course, thanks to everyone for tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It really helps more veterinary professionals out there discover our show. If you enjoyed this episode, you can find more episodes by checking out the VetFolio website or listen wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com, connect on Facebook at Dr. Cassie DVM, or follow me on Instagram at dr.cassie, CASSI.dvm. And remember, if one animal is better off because of you today, it's a great day.